Welcome. If you're looking for an online therapist to help you overcome anxiety or depression or addiction or any other common psychological problem that responds well to online therapy, then please consider the service that I offer. Visit my website, learn more about online therapy via Skype. So online therapy is a great option if you find it difficult to find a therapist in your neighborhood, or if you're living abroad, or if you're traveling. It's also a good way of getting good quality psychotherapy, but without the stigma, without having to go and present yourself in a public setting. Many people prefer the greater privacy offered by online therapy. Being able to speak to a therapist in the privacy of your own home is a significant factor for many people. Maybe you're suffering from depression or addiction. It's difficult to bring those into a public group setting or even to talk to a therapist in person. It's much easier to do it over the internet through Skype. So I've been offering mindfulness-based therapy over Skype for many years now, and I find it very effective. My clients really enjoy mindfulness therapy and the online therapy format, and you can read many testimonies on my website. It's a very good way of getting the help that you need without going the medical route. So I don't really advocate medications for treating anxiety or depression, because medications simply mask symptoms. They may provide a temporary relief, which can have some benefit in certain situations, but it's really important that you understand that medications are not going to treat the underlying cause of your anxiety or depression. And that cause is emotional, it's psychological in nature. You have to heal those underlying emotions if you really want to break free from chronic anxiety or depression. And the same goes for addictions as well. So besides the chemical aspect of addiction, which often needs medical intervention, you have to ask yourself, what is the underlying emotional cause that caused me to indulge in an unskillful way with alcohol or drugs? There's usually, if not always, an underlying emotional cause that's driving that addiction. It could be depression, it could be very low self-esteem, it could be trauma. That's very common. It's a way of escaping painful emotions for many people. That's one of the major driving forces behind addiction, trying to escape suffering. And it provides a temporary relief, yes, but as a long-term solution, no, it does not relieve the underlying emotional pain. You have to address that emotional pain, and you have to help it heal. From my experience, there's nothing better than mindfulness training and mindfulness therapy for healing emotional suffering. It's a very focused approach, very practical. It's quite different than conventional counseling. It's about looking at how you produce anxiety or depression right now. How does that work in the present moment? What is the nature of that habitual process? So we focus on two real main areas, one of which is looking at the patterns of reactive thinking that feed anxiety and depression and other intense emotions. It could be guilt, it could be shame, it could be a feeling of helplessness, whatever it might be. There is always an associated pattern of reactive thinking. Now, in mindfulness therapy, we teach it's not the thoughts that create the emotion. The emotion precedes those thoughts. But the thoughts have the effect of feeding the underlying emotions, rather like fuel feeds a fire. But the fuel cannot create more fire if there's no fire to begin with. It's just wood. So, but we need to work with reactive thoughts because they are a very important fuel source for emotional suffering. And mindfulness is about really waking up and seeing those reactive thoughts clearly, consciously, in the present. It's this aspect of waking up that's so important, rather than being dragged along by habit, which is what happens so often. And that is the real underlying problem with anxiety and depression. We just fall into that river of thoughts without any choice or any real consciousness. So changing this unconscious aspect of emotional suffering is a primary focus in mindfulness therapy. And I will teach you how to do this in great detail. I will give you the tools for doing this so that you can break free from these patterns of habitual reactive thinking. Another part of mindfulness therapy is developing compassion. Compassion towards yourself. Now, in mindfulness therapy, that has a very specific meaning. It means developing compassion towards those emotions themselves, seeing them almost as separate beings or objects within the mind. We often refer to them as being like children, and we are like a parent. We need to learn how to help those children heal because they are suffering. So that's a very important process of compassion that we develop in mindfulness training and mindfulness therapy. Mindfulness is the combination of consciousness and compassion. It must have both components to be called mindfulness. It's not just the same as awareness. Mindfulness is a very special kind of conscious awareness, and it has this compassionate quality. We approach our emotional pain with the intention of trying to help that pain heal. So we do this in various ways, but one of which is establishing this very compassionate and loving relationship between your true self, which is the consciousness itself, and the little self, which are the emotions and thoughts and memories and traumas and beliefs and all of the content that makes up our mind. But it's important to understand, and this is a primary teaching in mindfulness psychology, we are not the content. You are not your thoughts. You are not your beliefs. You are not your emotions. You are not your perceptions. You're not your memories. These are objects. What you are in essence is the conscious awareness itself, that state of being that can see thoughts, memories, emotions, and other objects. That part that can see those things and not become identified with those content of mind, those mental objects, that is what we call your true self. And the whole movement of mindfulness therapy is to really help you re-establish your identity as your true self and to overcome the habit of becoming identified with the content of mind, the little self. This is vital. You learn to become bigger than your thoughts and emotions. Only then can you help the thoughts and emotions heal. So you learn to become a parent to your thoughts and emotions. You learn to take care of them and help them heal. And this we call the true self, little self alliance. It's vital, and that's what we really focus on developing during mindfulness therapy. So if you like the idea of working with an online therapist, you like the convenience and the greater privacy offered by online therapy, and you like the idea of working with a mindfulness therapist like myself, I have been teaching mindfulness therapy for many years now, and I have written a book on the subject called The Path of Mindfulness Meditation. And I find it to be extremely effective, and people really enjoy this approach. It really gives you the tools to find a better way of living, of overcoming anxiety and depression or addiction, of breaking free from these very constraining and imprisoning aspects of the little self. It allows you to find who you really are and to find the happiness and well-being that is your true nature. So if you'd like to learn more about all this, then please contact me. Send me an email from my website. Let's schedule a Skype therapy session. Let's find out how this can help you with your particular needs. I've helped hundreds of people now, and everyone seems to benefit. Almost everyone has already tried conventional talking therapy. They've tried medications and found them to be completely ineffective most of the time. It can help you in the short term, but it doesn't really get to the underlying problems. That's the point here. Mindfulness therapy does. It helps you really change things at the core level. So if this interests you and you'd like to do online therapy with me over Skype, then please contact me. Thank you.